Welcome to Dermbusters, where we discuss common misperceptions in the field of dermatology and get some tips on how to counsel your patients. And today I'm joined by Dr. Emmy Graber, expert in acne and rosacea, so nice to have you here.
Thank you. It's great to be here.
Excellent. The first question I want to ask is about fatty foods and fried foods. I get this question about once a week from my acne patients, and I think I know the answer, but what can I tell my patients about this?
Yeah, that's a really common question. I get that a lot too. And there are some pretty firm fixed beliefs in society that certain fried foods or fatty foods cause acne. And it's interesting, studying diet with acne is really tough. It's hard to do the studies. It's hard to know. You know, the things we do know is that some studies show that high glycemic index foods, so some of our high carbohydrate foods, may induce acne for some people, but not for everyone. And some of those fatty foods that are greasy, like pizza, for example, do have a high glycemic index. So perhaps there's some truth to that for some people. The other part of that with foods, we do know the evidence is strongest for dairy products, especially skim-milked dairy products that may induce acne, not for everyone, but maybe for some people. And so, again, some of these foods may contain dairy products, like the pizza example, per se, contains cheese in it. That may induce acne for some people. But just to say broadly, fried and fatty foods cause acne, we don't really know that. In short, what I tell my patients is, if you really notice that there's one food that causes your acne, feel free to avoid it, but it's not something I regularly counsel patients on in order to clear their acne.
That's some great advice. Yeah, you don't go into the clinic saying, avoid fried foods, avoid skim milk, your acne will go away.
Right.
But if you're noticing something that's causing the acne, cut it out.
Correct.
Everyone is different.
Right. That is the bottom line.
Awesome. The next question is about my favorite medication. One of my favorite medications, isotretinoin. I think it works beautifully. I try to use it in all my patients, even if they have one pimple or two, because it's the best thing for acne. Yeah. You know, what works the best. So patients come in and their acne gets clear and they say, my skin looks great. Now I want laser. I want chemical peels. I want injectables. So what do you tell them about waiting the 6 months after isotretinoin is done to get some of these procedures? What should I tell my patients about this?
Yeah, I'm so glad you asked this one because I love to bust this myth of waiting 6 months. You know, the 6 to 12 month wait period was based on just a very small number of anecdotal cases where patients got scarring in doing procedures while they were on isotretinoin. It was really, the time frame was randomly chosen. And there has been in recent years a systematic review looking at over 32 published studies, over 1,400 patients who received lasers or other cosmetic procedures while they were on isotretinoin or shortly after. And this large systematic review said that there's no evidence really to say that you have to avoid these procedures shortly after isotretinoin or while you're on isotretinoin. And so this coincides exactly with what I do in my practice. So I do treat patients while they're on isotretinoin with the visible light lasers, hair removal, superficial chemical peels, perhaps even fractional lasers, even the ablative lasers, the fractional ablative lasers. That review showed they were safe. And so we don't need to be telling our patients to wait 6 to 12 months. Now, there are some exceptions, of course, if they're doing a fully ablative, meaning a non-fractionated laser or deep dermabrasion or a deep chemical peel. Those things, those are intense, deep procedures. They may want to wait until we have some more data, but there really is no evidence to suggest waiting. The interesting thing about this, too, is there's another more recent published study in the laser literature looking at patients on isotretinoin concomitantly doing pulse dye laser. And those patients did better. Their acne got better faster. They were less likely to have that initial purge. And so, it might not even be safe to do lasers while on isotretinoin. It might be better to do it. So really, we don't need to be telling our patients to wait 6 to 12 months.
That's certainly a paradigm shift, but I feel so much more comfortable now talking to my patients about this.
Yeah.
Might want to be careful with the Baker Gordon peels and the fully ablative facial lasers, but I think we're going a little bit overboard with that recommendation. So thank you for the answers. Appreciate your time.
Of course. Thanks for having me.